I wanted to ask you is having a larger scale, I would imagine this is a larger scale testing operation or testing like this going on in Anoka County, given what we're seeing in so many counties like Anoka County, including Anoka County. How important is that to have that testing here and available for people right now?
Having the testing at the Anoka Armory is critical for us, as without that, we do not have the capacity within just our public health department to do mass community testing. And so having that testing expertise in our community is very valuable. We also have contracted with a vendor to also do testing in our community, but their focus is primarily on congregate settings, group home settings, so larger group settings. And we're also fortunate to have that resource also.
So does this, what's going on at the Armory, does this kind of represent the largest public testing in the county to this date, or the longest? Because it seems like it's going to go on for quite a while, or at least they plan to be there for
11 weeks.
Yeah. So is this the largest public accessible to as many people effort so far?
Yes, correct. So this will run for 11 weeks. The schedule is on the MDH website. I know that their hours are varied. So it allows for flexibility for individuals, whether it be during the day or after work or on weekends. So that's extremely helpful to make sure we're hitting all the populations. It's just, you know, the Minnesota Department of Health has really fine-tuned this process. You know, when I went to ask for this, they were more than willing to come. And it represents the partnership that we have with them. And for that, I'm very grateful.
Is this something that takes quite a while to was it something you had to initiate by formally requesting that this happen, and then it's mobilized through whatever systems the state and or all these partners, the National Guard or whomever else is helping your office? Is there a formal process for that? And my other part of this is, at what point did you say we really need this to happen here?
Well, once I became aware that the governor was asking the SCOC to stand up different testing sites throughout Minnesota, I recognized very quickly that I wanted Anoka to be one of those sites. And so, I contacted them. I had a conversation about it with them, and very quickly they committed to coming to Anoka. And so after that, we just roll out our plan. And that process probably for us to set up this probably took a week or less.
Where do you stand now with these kinds of plans or these kinds of systems on a county level versus say where you had these maybe in January or February, kind of looking at this as, you know, this was kind of on the horizon, or even early March, and then things really just kind of took off. Have you adjusted the systems? Have you made substantial changes this calendar year as this continues to unfold? Or was there a plan already on a county level? And of course there are state, I know that you follow along with what the state does, but in Anoka County, was there a plan that was already in place for something to address a pandemic or this kind of situation? Or has that changed as it's gone on?
First off, public health, part of our everyday role in public health is to be prepared for community emergencies, right? So in Minnesota, we take a look at what the likelihood is for different types of emergencies, such as flooding, tornado, a snowstorm, those type of things. We have never planned for a pandemic like this. Nothing that was this intense and this long, right? The longevity here is probably the most critical piece of the response. And so as we have plans, so for example, we have like plans for our department operations is working, and we also have points of dispensing sites. So we will take our points of dispensing site plans and turn them out and use them for the vaccine, right? And so that's just an example of how our everyday emergency preparedness plan can shift to support this type of response.
Do you see this testing, if we continue to see numbers go up at the same rate that they have here, especially recently, maybe that is a product of more testing, but again, the experts are, from what I read and everybody says, it's not just because there's more testing, it is spreading rapidly.
Correct.
Is it going to become busier at the Army? Are going to see more people come out to get tested as we continue to see rates, or all of these adjustments now with schools and whatever the governor again says today, more adjustments, more restrictions? Do you think we're going to see more people come out for testing over the next coming weeks, especially also with the holidays ahead and perhaps people still gathering even though they're told not to and asked not to? Are there going to be more people getting tested as this goes on?
Yeah, this is something that we trend, right? And we forecast, probably out about 14 days. We try to forecast that. And yes, there's going to be an increased amount of uncontrollable community spread. There's going to be more people coming out because of that, right? Because we have no barriers testing, and there are you can just come, right? You can go to the MDH website, sign up, pre-register, or just come. Those sites are going to continue to be maximized or used very frequently. And then not only that, but there's a whole nother element where I have strike teams within my public health department that are testing daily critical infrastructure. So that is fire, police, EMS, 911 workers, because we need to make sure that those critical infrastructures stay up and running so that they can respond.
Yeah, we talked to a local fire chief this week because the state fire marshal's office has its new tools out for people to see where mutual aid agreements and shared aid and things like that, and which departments may have down numbers and things. So a lot of this continues to develop. I've asked anybody I get a chance to ask a few questions of, I'm asking this, and this is really far-reaching perhaps, but as you continue to develop the 2020 playbook, because there's so much that continues, and kind of the lessons from 2020, is there anything that really stands out at the top as like, we went through this and this is what we're taking from this moving forward for whatever happens next? Is there a major headline lesson that you feel like your office and you have learned?
We have to be extremely fluid. Our plans are changing literally day by day, and sometimes half a day by hour, right? We think we're doing one thing, and so my team has to be extremely flexible, and with our decision making. So we've learned to quickly assess, quickly make decisions, and implement and use the resources that we have. I would say that the biggest thing for me as the incident commander in this response is the fact that I need to maintain my staff, right? I need to do whatever it takes to get them in a place where they can continue to respond. This is a very stressful response. We've been at it now a little over 8 months. And so that is one of my biggest things. We know what our resources are. We know where we're low, and we continue to flex that and partner where we can. We're transparent about what we can and can't do, and then just making sure that my department operations team stays healthy, both physically and mentally.
Seems like it would be a tough call, especially that last part there, but I would imagine you found ways to do that and just keep pushing forward, it seems like.
Yeah, so I've had to pull in some outside resource to help with consultation throughout this response. I started that very early on because I knew it was going to be a long haul.
We must slow the spread of COVID-19 to protect our communities. Right now, it is important to wash your hands often, get tested if you have symptoms, stay 6 feet away from other people, wear a mask when you go out, stay home when you can, and work from home when able. Thank you for doing your part. Stay safe, Minnesota.